Ruth, I am super excited about our 7-minute schemas today. What's happening for some clinicians is that they'll be seeing people and they're starting to question, is this somebody who has ADHD in front of me? And I'm so super pleased that we've got Dr. Shapiro from New York, who is a psychiatrist and a schema therapist and an expert on ADHD.
Thank you so much for inviting me.
Now, one of the challenges, I think, Scott, when we're working with clients who either have a diagnosis of ADHD or perhaps we're suspecting may need to have that investigated, maybe having some of those kind of presentations, is they might score quite high on the insufficient self-control schema, right? So that's a schema in schema therapy. And I'm curious your thoughts on that. How do you talk about that with clients? How does that fit within an ADHD frame? What are your thoughts?
So that's very interesting. How do you, especially if someone comes to you and has not been diagnosed, how do you determine collaboratively with the client, is this ADHD? Is this insufficient self-control or limits? And what modes might be going on? And I think that during the initial couple of appointments, during your evaluation and assessment, to include an evaluation for things like depression and past history of depression or ADHD or anxiety. And if there's a high suspicion of having a long history since childhood of, of symptoms where they were struggling in school or where they were procrastinating, losing things, feeling like they were in a fog, that it may be due to trauma or due to some certain schemas, or it could be due to ADHD. And if there's even a little suspicion, to either evaluate them or to send them to a colleague for an assessment, I think makes a lot of sense. And let's say they do turn out to have ADHD and they start getting treatment with medication. When I talk to audiences or to colleagues about ADHD, that treating someone with medication is only really part of the treatment. It's not providing them with comprehensive treatment. I think that schema therapy plus medication or some type of therapy that's going to be effective to address these long-standing issues is core. Because, for example, when this woman was treated with medication, those schemas of feeling low self-esteem, of feeling defective, of not having the skills and strategies and behaviors of how to have time management, of how to have structure, of how to organize projects, those still were there. The medications don't fix that. So the schemas, even when the ADHD is diagnosed and treated, the schemas still need to be addressed.
And so, Scott, when it comes to defectiveness, shame, emotional deprivation, some of those schemas, I think clinicians feel really confident in addressing those, particularly if there was undiagnosed ADHD. I think that when it comes to the insufficient self-control schema, there's a little bit of confusion. Is it genuinely around the way that individual's brain works and kind of, being able to perform tasks? Or is it a mental representation of themselves as they've completed the YSQ, that they have
Yes.
insufficient limits, because we talk about a schema, completing the YSQ as being a trait, but of course we know when someone's completing a questionnaire, it's a mental representation of how they understand things in that moment. So I've had this question a lot lately, and I'm getting the sense that practitioners feel like they don't want to be not neuroaffirming.
So I think that that's a really insightful question. And that conundrum, I think, is with all of us. That where does it start in terms of the ADHD and where does it start in terms of the schema? And I think it really comes down to what are the client's goals? What are their values? And where do they want to be? The way I work with my clients is very collaborative. And so when they're looking to maybe get a promotion or to graduate college or to go on to grad school, I'll say to them, these things are possible when I think that they're realistic, but I talk about how we can't just say that this is due to ADHD or due to insufficient self-control or limits, that we work collaboratively. And I really work, with imagery and with teaching strategies and behaviors about how to improve their self-discipline, their time management, their goals, working maybe with their interpersonal skills with other colleagues. And so I've seen people make tremendous progress in terms of recognizing that these are things that they want. These aren't things necessarily that are coming from their parents or that are coming from a spouse, but these goals are things that we both kind of collaboratively decide are achievable and things that they want. Let me go back just to Ellen for a moment, if that's okay. So she had been fired from, I think, about 4 or 5 jobs and was a project manager that required an enormous amount of details and organization. That's not her strength. And in addition to that, just like what we know happens in schemas, that these schemas repeat themselves, she ended up with a boss that was extremely critical. It was a very toxic environment. So as her schemas healed, she ended up leaving that job and starting her own business where she could determine where, when she had her best energy, when she had her best focus, what she wanted to work on. And also just having that autonomy and not having someone kind of on top of her and criticizing her all that time, it was very energizing. And one thing that's often talked about with people with ADHD is really finding your passion, because when you find your passion, that can really help drive and help you overcome some of the limitations from ADHD and help you to address some of the modes that may be getting in the way.
There's really aiming to strengthen that healthy adult who can be aware of my rich strengths and capacity to focus and be driven by passion and start to make choices about my values and not just being driven perhaps by my critic who says I should be able to do certain types of jobs, or my parents, or the dreams of other people, but building that healthy adult who can really work well within who I am as a person and play to my strengths. Thank you, Dr. Shapiro, for the nuanced and thoughtful way you started to open up these topics for us. If you want to find out more information about Dr. Shapiro's work, you can visit his website. That's going to be linked at the bottom. But that's our 7 minutes.